You're listening to the Quint podcast.
With a relatively low number of case growth in July, Delhi's COVID data is finally starting to reflect a declining trend. After recording at least 2,000 new cases almost every day in June, the number of fresh cases in the capital dipped below the 1,000th mark in July. The lowest being 613 new cases on 26 June, which was a 62-day low. Compared to the last month when Delhi was spiraling out of control, even overtaking Mumbai's caseload at a point in time, all numbers from this month in the capital is showing a remarkable improvement. Along with a dip in the number of cases, the case growth rate has slumped down to 1.7% from the previous rate of almost 6% as per reports. The recovery rate is at 88% from what the government data shows. And Delhi Chief Minister Arvind Kejriwal has also said that the positivity rate, which is the number of people tested positive per 100 tested people, is also down to 5 out of 100 as opposed to 35 out of 100 in earlier months. Although the Delhi government credits the ramping up testing strategy for its road to recovery, experts are looking at these impressive developments with a slight amount of skepticism. While the number of cases have visibly dropped in the city, this also interestingly coincides with the Delhi government using more and more rapid antigen tests, which have a high rate of false negative results. So are we looking at a genuine turnaround, or is it Delhi's testing strategy? What is the situation in hospitals looking like? Is the worst over yet? In this podcast, you'll hear from Dr. Shahid Jamil, a virologist who will be giving us an analysis of Delhi's data, and Dr. Sumit Ray, a critical care specialist who's been treating COVID patients, will be talking about the situation on ground. You're listening to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Sholbury. After a challenging past few months in the capital with a sudden surge of coronavirus infections, as Delhi managed to temper down its COVID situation in July, Chief Minister Arvind Kejriwal recently took to praising the Delhi COVID model. In a press briefing while informing citizens of the development in the data, Kejriwal also talked about how Delhi COVID model is being discussed across the country and the world.
दिल्ली के अपने 2 करोड़ लोगों की मेहनत, सूझबूझ और सावधानी की वजह से अब पिछले कुछ हफ्तों से कोरोना की स्थिति दिल्ली में काफी सुधार हुआ है. कोरोना की स्थिति में आज दिल्ली मॉडल की चर्चा.
The hard work and precautions taken by Delhi's 2 crore citizens have finally paid off. The coronavirus situation has improved significantly in the city. Today, the Delhi COVID model is being discussed across the country and the world. They are talking about how the citizens of Delhi came together to bring down the infections. On one hand, while there has been a surge in COVID-19 cases across the world, on the other hand, in Delhi, there has been a drop in the numbers. Today, 88% of those who contracted the virus have recovered, that is, 88 out of 100 patients. Only 9% of the cases are active, and about 2 to 3% of patients lost their lives. The notable point is that the fatality rate has dropped significantly.
और 88 लोग ठीक हो चुके हैं. लगभग 2 से 3% लोगों की मौत हो चुकी है. सबसे बड़ी बात यह है कि दिल्ली में मौत की मरने वालों की संख्या में भारी गिरावट आई है.
While Kejriwal lauded the Delhi model and the flurry of new measures that the city adopted in the past few weeks to check the transmission, such as door-to-door checks, home delivery of oxygen concentrators, and most importantly, increased testing, the Delhi High Court pulled up the Aam Aadmi Party government on 28th July for choosing the rapid antigen tests, or RAT, instead of the RT-PCR tests as its frontline tests. Now, the difference between the two is that antigen tests are usually much faster than RT-PCR tests. It's cheaper. It can be done outside laboratory settings, but comes with a caveat that it has a high tendency to show false negatives. Yes, it is an ICMR approved method, but those who test negative are also mandated to get an RT-PCR test done. Now, to get into numbers, as per Delhi government's own data submitted to the High Court, Delhi has been conducting more antigen tests than the others. According to a report on the print, till 15 July, it had conducted a total of 281,555 rapid antigen tests, out of which 0.5% had to go back for follow-up RT-PCR tests, and as many as 17.8% of the follow-up tests showed a positive result. So yes, while Delhi's testing rate is significantly higher than the national average, it's also conducting a lot more antigen tests. So is it possible that some cases are slipping through the radar? In its defense, the Delhi government told the court that it's been following the ICMR guidelines on antigen tests. But is the skepticism around the testing method legitimate? Is it a genuine turnaround, or is it Delhi's own testing strategy? Dr. Shahid Jamil believes that there is improvement. While there is no absolute certainty on the quantum of numbers, he says that the lack of pressure in hospitals definitely hint at a turnaround in the COVID situation.
No, I think there is a turnaround, and that's simply because one doesn't find the same type of pressure on hospitals as you saw maybe 4 weeks back. So there's definitely a turnaround. I don't know if the numbers are correct because even the High Court has said that they are doing more antigen testing than confirmatory PCR testing. So without actually believing in the quantum of numbers, I would say that Delhi's situation is improving. People coming to hospitals as were coming 3 to 4 weeks back.
Right.
So whether the numbers are correct or not, I won't debate that. But that's something for everyone to see.
So what is the situation in hospitals really like? I called up Dr. Sumit Ray, who's been treating COVID-positive patients, to understand the situation on ground. Are the hospitals indeed reflecting what the data suggests?
Delhi's daily count of corona cases is surely going down. We are seeing it on the ground in hospitals. The hospital admissions and the ICU admissions are surely going down, and the evidence suggests that the number are coming down. Well, are the numbers exactly what are being shown by the government at 600 per day? Well, that may or may not be exact because of the antigen test rather than the RT-PCR. But the fact is that there is a decline. And the reason for that, and if we have to look at the patterns across the world, we see that in other cities also, in New York City, in Lombardy, etc., the peak phase of the disease of the COVID, severe COVID illness is for about 10 weeks, varying anywhere between 8 to 12 weeks in a particular urban conglomeration. And then it seems to shift and hit another spot or multiple spots at the same time. So each individual city or urban conglomeration is getting its peak effect for a period of about 8 to 12 weeks, and Delhi exactly fitted that pattern. And if we see the seropositivity rate at 23%, this was almost the same percentage as New York City of 21.8% that New York City had in the same phase of the pandemic for that city. So when we are seeing a seropositivity rate close to about 25%, this disease seems to decline in that spot. And in a sense, probably it is a harbinger of the fact that we are possibly heading towards more herd immunity.
And speaking of herd immunity, among the revamped plans to handle COVID, since the centre and the state joined hands to fight off the pandemic in the capital, has been the serological survey that Dr. Ray talks about. This test is about detecting antibodies in the general population. And as part of the survey, which was conducted between 27 June and 10th July, 21,387 samples were collected from subjects picked at random at 11 districts. And antibodies were detected in 23.48% of the people surveyed, indicating that they had been exposed to the coronavirus. Commenting on the survey, Kejriwal suggested that the results showed that Delhi is moving towards herd immunity. So is the worst over? Are we really heading towards a herd immunity now? Dr. Jamil says that it's only partially right to say so. He says that it's inevitable to be heading towards a herd immunity as more and more people get infected, but we don't have any numbers to support how many people have herd immunity.
Well, firstly, moving towards herd immunity is a very sort of ambiguous statement It's like saying that we are moving towards death. Of course, everyone is moving towards death. Every year that you complete in your life, you move towards death. But doesn't mean that one will die tomorrow. So it's the same thing. Yes, you are moving towards herd immunity, but you don't know at what percent of population being immune you will get herd immunity. Nobody has set that number, whether it's going to be 30% or 50% or 60% or 90%. So to say that we are moving towards herd immunity is partially right. Even if 1% of the population is infected and you go from 1% to 2%, you're moving towards herd immunity. But he's not saying how far we are from herd immunity. So that's an incomplete statement, really. So I really don't know what it means, moving towards herd immunity. I mean, nobody's given a number for it.
Right.
But I think it's we're not out of the woods yet. So for people to become complacent, thinking that herd immunity is here, would actually be quite dangerous.
So even though Delhi is making progress right now, is it possible to see a reverse trend too? Can we peak yet again? Dr. Jamil says that it's entirely possible for that to happen. Case in point, Kerala.
Of course it can return. We have seen it have happened in Kerala. Kerala is sort of going towards its third peak right now. They went all the way to the baseline. For a couple of days, they had 0 cases, new cases being reported. Then, they got flights coming in from overseas. People came in, infection came back in. People started attending marriages. People started attending temples and mosques and churches. Things came back. So yes, of course they can come back.
If you like listening to this episode, please subscribe to the Big Story playlist for episodic updates. We're live on Apple, Google Podcast, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website and check out the podcast section. For any feedback, shoot an email to podcasts@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.